I'm Sunita. I'm going to be talking today about how I use DCP in my day-to-day consulting. So I find DCP most helpful even before I've called the patient in, so I can see who I'm calling in today, what I need to prioritise in terms of what I accomplished today, what I might be able to delegate to the practice team, and what recalls they might be due for sometime soon. So I can see that we have an 18-year-old patient this morning who's of Aboriginal background. She's obviously filled in our automated clinical update sheet, which tells me that she's currently a non-smoker, and she's updated her family history to include high blood pressure in both parents. Currently living at home with parents. And with the recalls that she has due, it seems that a review of her asthma and a skin lesion might be the most urgent, and perhaps I might need to get her back to do on a different day. She might not have already had the flu vaccine, which is relevant this time of year, particularly in terms of her asthma as well, and it might have been some time since we last did her asthma plan, so if I put it together I can get our nurse to go through it with the patient. My common practice is to defer the blood pressure and the percentile measurements and some of the asthma education to our nurses when they also do the flu injection. We may or may not have time for that spirometry today, but some assessment of her asthma would go a long way to making sure she remains well. When I get her back for the pap smear, I'm going to have to do her chlamydia check at the same time as well. If I get time at the end of the consult, I might briefly mention opening up one of the health records for herself. She might be interested in viewing her medical summary at home. She hasn't had her ATSI health assessment in the last 12 months. Neither has she had the asthma cycle of care completed, so perhaps today we can go some way towards that and then get her back a different day to complete the health check and the spirometry and pap smear.